I know there was a lot of controversy around the Health and Social Care Act as it was going through Parliament, and people were very concerned about what Monitor's new role would be and what we would do with it. I think the most important thing is to go to that primary duty that we've got, which is about promoting and protecting the interests of patients. That is going to determine everything we do, and nothing will be done for the sake of it. All that we do will be for the sake of patients. Carrying out our new role is going to involve quite a lot of quite complex things that we're going to have to do, but at the heart of it, it's about creating incentives for the people who are providing care or commissioning care to do the best for their patients. It's about making sure the right information is available for them and for the patients themselves. And it's about making sure that where there are rules for how things should be done, that people are following the rules. That's the heart of it. Monitor's going to have to make a lot of changes to take on these extra duties, but I think I'd pick on two things in particular. First of all, we're really going to have to change our focus. At the moment, we're very focused on institutions, on hospitals. In the future, we're going to have to really be focused on patients, and I think that's going to be a big change in our mindset, which is going to be very important. We've really got to understand what it is that patients want from the NHS. The second thing that we're going to have to change is that because delivering better care is about what doctors and nurses and other people on the front line do, we're going to have to reach out and engage with those people. We're going to have to understand what it is they need to be different that we can do to help them make the difference. Monitor's job in many ways is to help everybody else deliver better care for their patients. So whether that's commissioners who are buying services, the new GP groups of clinical commissioning groups, or whether it's the people providing the services, the hospitals, the ambulance trust, but the people on the ground, the doctors and the nurses who provide the care, they're the ones who are going to make the difference to the patients. Our job is to help them do that as best as they can. In addition to the CQC, we're going to be working very closely with the Commissioning Board, which is a new body that's being set up to oversee commissioning, so they will have a strong relationship with all the clinical commissioning groups, the groups of GPs doing commissioning all around the country. And we'll be working very closely with the Commissioning Board on things like setting prices for services that the NHS provides to commissioners and trying to get better integration of services around the needs of patients. Many areas where we're going to have to work very closely together. The job of the CQC, the Care Quality Commission, is to make sure that all providers of health care are providing safe, good quality care. And if they're not, the CQC can tell them to do things differently. They can even tell them to stop providing the services until any problems are fixed. Our job is to make sure those problems do get fixed. In the first instance, it's the responsibility of the leadership of the providers, so the board of a hospital trust, for example, to make sure the problems get fixed. But if they're not able to do it, we'll step in and make sure it gets done. What the licence that we're going to be issuing will enable us to do is to perform those functions which are at the heart of our new role. So it'll be things like helping to make sure the services provided to patients are better joined up, better integrated, making sure that if there is competition, that it isn't unfair, applying the prices that providers have to pay, and finally making sure that if providers get into difficulty, the services they're providing, where they're essential to their local communities, continue.